I totally had an intro planned.
Oh, well, let's crush it then.
No, too late. Like, it was going to be like more organic and, kind of introducing her and being like, say that she was my side chick because she'll do things to me and my girlfriend won't or can't.
I mean, we could put that in
She
here.
does things to me my girlfriend can't.
We can definitely put
Dr.
that in
Dani,
here.
everybody.
We can definitely put that in here.
No, that's okay. But like I said, Dani's a friend.
Yeah.
Like a real friend. I'd do anything for her. So.
All right. Well, here we go. Episode number 6.
This would be episode number 6.
6 with Dr. Dani.
Our second guest.
Second full-time guest. Full-time guest?
Full-time guest?
Yeah, second
Not
guest. Whatever.
Yeah.
She's great.
It's fine. I just work here, dog.
Dude, you have your picker figured out for guest.
Interesting people.
Yeah,
That's what
she
it all
was
boils
great.
down to.
Mm-hmm.
So, Mr. Colton, what'd you learn?
Well, I've known Matt long enough. Chiropractic is like the baseline. But it was what I took away from it more than anything was who she was as a person and like why she does chiropractics and what is important to her in chiropractics. It's not the chiropractic itself. It's the people and forming relationships and doing it because she cares. It's not about a paycheck. And that was like when she gave her spiel about why she does it and stuff like that, mentally I went, yep, there it is. Like, that's enough for me. That was all I needed to hear.
Literally the epitome of what we set this podcast up for. Her biggest why. And hell, she wraps it up like 20 minutes before we end the episode. She's just very much, it organically came out, but she's everything that we want out of somebody that comes on here and everything that I want out of someone that gives any medical treatment to me.
Absolutely.
So who is she? Tell us about her.
She's my chiropractor. She's a friend, I don't know how to describe her. Like, I started going to the facility that she worked at. I was having some really bad lower back problems and having a lot of headaches. And I got some adjustments from other doctors that worked there, and it just was really lackluster in the way that the place is set up. You just get who's available. They it's the golden corral of chiropractic facilities around here, and they just herd them in and herd them out, and whoever had an open table is who you got. They were okay. Then she adjusted me one day, and I could tell there was a difference in the way she did it. And after that, like, I didn't request her every time I went because I didn't want it to seem creepy. She was the only girl that worked there, and I didn't want it to come off like I wanted the girl working on me, But she did a better job when she adjusted me. So then I would just like hope that they would be like, Dr. Dani's got a table, but that would happen, 1/3 of the time, basically. There's 3 doctors in there working, and you just get who you get. Then she got me another couple times, and finally I asked, I was like, can we request to see a specific doctor? And they were like, absolutely. And I was like, nobody but Dani. No, ever. And that's the way it's been ever since. And she's seen me, what is it now? May 5th, 4th?
Yeah.
She's seen me about 30 times this year already.
Dang.
Yeah.
Dude, I can just tell in how you were other chiropractor to now. You just seem like stuff doesn't hurt. Like it went from it went from urgent care of like, I need to get fixed. And now it's kind of a preventative maintenance. Like she just keeps you in line.
It's mandatory.
Yeah.
Yep. And I'll go see her. It's not like she keeps me from hurting ever.
Yeah. Things
flare up occasionally, but because I go see her as often as I do, it gets in line faster and it gets out of line less often. Like I told her when we were wrapping up, she's become really important in my life because she's a foundational part of my healthcare. I've gone through phases with my lower back where I can't hardly walk.
Yeah.
And I've gone from having days where I can't hardly walk to training jiu-jitsu 2 and 3 days a week now and lifting weights and being far more active. That's because of her, dude.
Yeah, 100%.
Every other chiropractor I've ever seen, they run through the face down, push on your back, work their way up or work their way down, however they do it, turn on your side, do the little twisty twist thing, pop your neck, and send you out the door.
Yeah.
It's like 3 or 4 different movements, and you're done. Just cranking you in and cranking you out as fast as they can to get the next patient on the table. And when I started seeing Dani, I felt like she worked on me. Like she was working on what was wrong with intention of trying to fix it. Not just pop, 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 next. She was working on me. And she got to know the issues that I had going on. How's this today? How's that today? I'm going to try this adjustment. Oh, this, because we have a hard time adjusting you this way. It doesn't want to move real good on this side. I'm going to try to adjust this side first. She tried different things until she got the result that she was looking for. She just cares.
I was to say, you can tell it in the way she talked. I mean, like she walked down the stairs into the studio, and I had never met her, and just the way that she introduced herself seemed like she cared. And through however long we talked, nothing but care came. She's very relational, very professional, but caring is kind of her heart.
Absolutely.
So
no question about it.
She absolutely encompasses why she does what she does.
She's a fucking great person.
She is. You being our second guest, we all knew Eads. He's kind of one of the guys.
Yeah.
So this one I tried to church up a little bit because this is very man cave. My wife hardly comes down here unless it's storming. This is just kind of our spot. She comes down here to work out and then this, and that's about it. But it's man cave and she hates it.
He put a candle on the table.
100%. I was like, hey.
That's cute.
Hey,
Yeah.
so
That's
Matt's
nice.
chiropractor's a girl. She's like, take at least a candle. And then I just bought some fruit yesterday. Take some fruit down.
Oh my
so
gosh, that was so nice.
we have fruit and a candle. I think the candle thing might
That's
be a deal.
adorable.
Yeah, the candle thing and like half-ass charcuterie bowls.
No,
Yeah,
these are.
I like it.
Hold on,
I
these
told
are.
him it
Let's
has
talk about these though. These
they're
are
cotton
cotton
candy
candy.
grapes.
No,
Those
I
aren't
love
just
those.
this ain't no middle of the mall shit. We're high class over
Uh huh.
here.
If any of you want any of that, there it is. We put those selectively by the guy who was like, I love cotton candy grapes.
How did you know they were cotton candy grapes? They just look like grapes.
I made a comment about how the cotton candy grapes were so good, and he was like, "They actually are cotton candy grapes."
Oh,
No,
Because I opened the thing, I was like, cotton candy grapes? Yeah. And I mean, I normally just like green grapes, but these are really good.
Doing that healthy thing.
Healthy.
Yeah.
Yeah.
You're doing good though. You've lost. I mean,
Like
you're looking good.
30-some pounds.
Yeah. Yeah, that's crazy.
I got asked if I was sick the other day, though.
Really?
Are you sick? You've lost a lot of weight. Like a fucking cancer patient now or something.
You're not there yet.
Yeah. But I'm going to try to lose like another 15, I think.
I don't think you'll be
Yeah.
there.
Yeah, that's a lot.
You won't be like cancer sick.
I'd be about like 185. I mean, I've still got like back fat and love handles and all that. So I'm trying to like get low body fat percentage before I start trying to put on muscle.
Start with your introduction. Tell us who you are and what we need to know about you.
My name's Dani. I go by Dr. Dani sometimes. I am a chiropractor in Joplin, Missouri. I am originally from Lincoln, Nebraska. I moved down here because my in-laws live here. Otherwise, I would not be in Joplin, Missouri.
From with
But
Joplin, Missouri. It's great.
it's all right.
So much different than the sprawling metropolis of Lincoln, Nebraska.
It's a little slower pace of life down here, but it's good. It's been good. Yeah. Been down here for going on 3 years. I just opened my own kind of practice within another chiropractic practice. Today was my first day, actually. So really excited about that.
You
Sweet.
should be.
Yeah. Matt talks you up.
Dude, she deserves
appreciate it,
Like, she genuinely deserves it. You know that I got into chiropractic, like seeing a chiropractor. How long's it been? 2 years probably ago.
Going where I go?
Yeah.
Dale, probably about 2 or 3 years.
Yeah.
Yeah.
A couple years ago, started, taking chiropractic really seriously. And I've told you, like, I grew up with a chiropractor in the family.
Yeah.
So it's always been a thing for me. I've always believed in it, kind of was forced to believe in it when I was a kid. Something that I thought believed was necessary. It just makes sense to me. Like, there's people that think it's quackery, right? I mean, you know that. You've heard it from plenty of people over the years, probably. What,
yeah.
you're a chiropractor? Hocus pocus? Like, that's stupid.
Snake oil?
Yeah.
Yep. All the things.
And it only makes sense. Like, everything that your body does, every function in your body is carried out off of your spine. From your brain, correct me if I'm wrong here, but the signal is sent from your brain down the interstate, your spine, and there's little off-ramps that are nerves,
Yep.
right? And if something in the spine is out of whack, it creates unnecessary pressure or placement or something on a nerve that then hinders the function of whatever that nerve operates, right?
Yep. 100%.
So chiropractic to me is foundational in a health journey for somebody. Like, if this shit ain't right, nothing else off of that off-ramp is going to be right. Right or
Yep.
wrong?
Right.
Okay.
Correct. Yeah. And I think that's something that's really hard about chiropractic. Chiropractic's a weird profession. Because you do have the people who kind of give chiropractic a really bad name, like the quacks of chiropractic. And there's definitely, some of that going on. But if you do have a really good chiropractor that knows what they're doing, then, it is really super beneficial. So
What led you to it?
So I actually started off, if you would have told me I was going to be a chiropractor like 15 years ago, I would have called you crazy. I started off, my undergrad was actually in forensic science and entomology. And that's what I initially wanted to do, was be an investigator, specifically like with entomology. But then I realized that was like not a real thing. So
No, that's great. We use those people once every 5 years.
Exactly. Yeah. So, and especially Lincoln, Nebraska, Joplin, Missouri, those aren't places that,
You dig up a lot of dead bodies you need.
Exactly. Yeah. Examination for.
I mean, I'm trying to use context here to figure out what the fucking entomologist is.
Basically just insect science.
That's what I thought. Okay.
Yeah.
We did that on one. In 6 years back there, I've done that on one.
So we're going to get way off in the weeds before we ever really get into chiropractic.
Great
What
news.
made you
That's
want to
fine.
do that?
So I started off doing like forensic science, and my degree is like specific for like CSI, like crime scene investigation. And then I had one entomology class that we were required to take in school. And I took that one class and I like just fell in love with it. And then I realized I was first doing forensic science and I was minoring in like psychology and chemistry or something like that. And I realized I could do, with less classes, I could double major in insect science and forensic science versus doing 2 minors. And so I was like, heck yeah, sign me up. I love it. So that's what kind of, got me into it initially. So.
Insect science.
Did you go to UT?
I didn't. I actually went to UNL, so the University of Nebraska, Lincoln. Yeah,
Close to home?
Cornhuskers.
Yeah.
Yep.
Hell yeah.
Yep.
So I asked about UT because Body Farm, they do a lot of that there.
I actually looked into that for a while. Yeah. I thought about doing like a master's program there, and then I was like, that's going to be a waste of my money and time because I'm never going to get a job in that. So
then what is your doctor's of chiropractic?
yeah. So then I went to Cleveland University in Kansas City and got my doctorate in chiropractic. Basically what it is, it's like a 4-year program. I guess it's like technically 3 and 3/4 year or whatever, but a 4-year program, you get your doctorate, and then you can practice chiropractic in any state.
You had a residency and everything?
Nope, no residency. So I just you just get to go right into it. Yeah. So it was good. Yeah. And that was, my stepdad's an optometrist. So I was kind of in between when I decided forensic science wasn't the route I was going to go. I was like in between whether I wanted to go and be an optometrist or I want to be a chiropractor. And ultimately it came down to like, I didn't want people to think that I was like riding his coattails basically. Cause he like has his own practice. He's super successful in Nebraska. He was like the president of the Nebraska Optometry Association, all the things. And so, I decided to do chiropractic and kind of like make my own route, my own name for myself. So
you could have easily taken the easy path and just been like, yeah, I'll do that
Yeah.
and jump into his practice. And
yeah,
Hmm.
yeah. And make bukus. And here I am.
How influential is he in your life?
Very.
This makes sense. You've been in chiropractic for how long?
This is year 3.
Year 3.
Yeah.
And you've developed a following. Like you're becoming successful in that field. And hearing about your stepdad being like a high performer in his field and being influential on you, you're headed down that same path for yourself here.
Yeah. And I think that was something that like through my childhood was always like super prevalent, and honestly maybe something that makes it kind of hard for me sometimes is that both my parents were like extremely successful, and like I grew up in a very, I wouldn't say like rich household necessarily, but like we had a lot of money and like they made a lot of money. They were really successful. And so I put a lot of pressure on myself in that aspect, because I feel like I have to kind of like keep up with Joneses in that aspect of that. But yeah, it's been good though. Yeah, it's been good to me. It's been rough, like starting out, making, finding people, getting that following. It was a struggle, but it's been good.
so you've been doing chiropractic 3 years, all of it down here,
Yep.
Southwest Missouri,
Southwest Missouri.
all the same place. That place is fairly new.
Yeah. So the joint has been open for about 2.5 years, I would say. And I've been there for 2. And then I worked at a practice before that for about a year. It was a private practice and it was just not a super great situation. Like, the joke in chiropractic school is that like chiropractors eat their young. And that is like 100% facts. Like they will underpay you, they will overwork you. And that is exactly my first experience with chiropractic. That's what it was. Yeah. I was making $50,000 a year being a chiropractor, working 40, probably 50 to 60 hours a week. No like compensation for like driving back and forth, none of that. So yeah, it was rough, but yeah. So then I switched over to the joint, which was a good move for me. Met a lot of people there, like Matt, which has been really nice, but yeah, it's been a little struggle. So.
The joint had to give you exposure that a smaller private practice wouldn't have given you.
It did. And I appreciate the joint so much because it did, like, I learned so many different things for there. And it being an open bay adjusting area, like, I liked that for me being young and, like, fresh into it because I could see one of the other doctors doing something and I'm like, hey, I want to know how to do that. How did you do that? And then, like, we just kind of, like, bounced ideas off each other, which was really cool. I feel like I progressed a lot as a chiropractor because of the joint. And so, yeah, I have like no bad blood, nothing against the joint. I loved working there. So
You just found a better opportunity personally, professionally.
Better opportunity, better hours for me. I have a son. He is 1.5 years. And so like the joint hours, I was working from 10 to 7 every single day, and then certain weekends here and there. And so I just missed out on a lot of his life. And I was like, you only get one opportunity to, be with your kid and raise your kid. And so, yeah, I wanted to make the best of that.
So at the joint, I don't remember what I was going to say. I had a question pop up into my mind and now it's gone.
I'm vaguely familiar with their model, but I would hear bad stories about, well, you kind of get whoever's there. And then I found out, well, we're kind of picking and choosing who we do. And they probably frown on that. But, I mean, like you said, it gets you a lot of exposure. So how many people went through the joint? Because it's subscription-based, I would say.
Yeah, for the most part, like the majority of our patients, so there's like a plan, like it's called the wellness plan, and it's like $79 a month. You get 4 visits to use in the month, like however you want to use them. And so it's pretty, affordable for people, which is huge around here because let's be honest, Joplin,
Not the most affluent area.
yeah, not the most affluent area.
Oh yeah, Southwest Missouri is a pretty poor area.
Yeah,
Yep.
poor area. And so a lot of people love it because of that, because it's cheap, right?
Yeah.
But the problem with the joint is that, like you said, you get kind of whoever, you can request people. And a lot of people do that, at the joint. They have like the certain people that they want to see, which is great. But then if there's one person that's really good at the joint, then they start seeing, a huge portion of the patient load.
Which is where you were.
Yeah, to an extent, yeah.
She's not going to shine her own wheels. I'll do it.
That's fine. We'll do that for
Sat
you.
in line waiting
Yeah.
to see her, and towards the end, I was never the only one waiting to see you.
Yeah.
There could be 2 other chiropractors back there, and they're like, "Oh, such and such has a table open," and everybody's like, This is what it is.
Which is
we've-
cool.
We've been at the
but-
receiving end of text saying, I'm going to go. What did he call her?
Oh, I called you a chiropractor Jesus lady.
Oh yeah.
Like
I
he'll
love
talk
that.
about it, and he'll be like, "Dude, I think we were sitting at his house, and he was like, this is the first time that like nothing hurts." He said, nothing hurts." He said, "I don't have neck pain. I don't have back pain. Nothing hurts."
Yeah,
It's because of
that's
her.
awesome.
It's
Yeah.
100% because of her. Yeah.
Well, I appreciate it. Yeah, that's awesome.
So I like that it got you that exposure. But it
Yes.
sucks because you're stuck carrying the workload. High performers always get stuck with the workload.
Yeah. And I am I am a people pleaser, hardcore. And so, yeah, like I don't say no to people. So if people ask me for something, I do it, which is probably to a fault a little bit in myself, but that's just kind of who I am. So it is what it is.
And then another total side note.
Yeah.
You're tall, like 5'10".
Yeah, probably about, 5'9" and a half, 5'10". Yeah.
Nailed it.
Yep. Pretty close.
Volleyball, basketball.
Softball, basketball, and then I high jumped in track.
Okay.
Yeah. And then I went to college and played softball for a year. Absolutely hated it. And so I went to Missouri Western in St. Joe for a year and played. And then I moved back home because I hated it.
St. Joe's rough.
St. Joe was rough. Yeah, it was rough. But everything shapes you to who you are. So
100%.
it is what it is.
We all have different stories of how we ended up here. I ended up in law enforcement way late in life. Made a lot of changes, but everything I did set me up and made me who I am today.
Terrible decision.
It was a horrible decision. No, I'm
Yeah.
just playing. Like, I love it.
Yeah.
Okay.
Dude, today I loved it. My job was great today.
It'll suck tomorrow. So when you
100%.
decided you didn't want to fuck with bugs anymore,
Yeah.
why chiropractic? Like what was your interest in
Yeah.
that at that point?
So couple different things. One, back to my stepdad. He had, when I was growing up, he had really bad like neck issues, like pinched nerve, like did the whole MRI thing, like had, all that stuff going on. They wanted to do a neck fusion on him. And he didn't want to do that. And so he started seeing a chiropractor. Actually, his name's Dr. Cooksley, who he was seeing in Nebraska. And Dr. Cooksley actually ended up being like a huge influence in my life, huge mentor for me for chiropractic. But that kind of came later on when I was playing softball at Missouri Western. I had gotten a concussion and I fell, weirdly, not even like sports related, but fell on ice and like hit my head on the side of the ice. And my neck was just completely messed up. Like, and I always was one that performed well in school. Like I was super like performance driven, always did like good, like grades were always good. And I started like slipping in school just because I couldn't focus. Just like headaches, neck pain, just, I don't know, something was off. And so I started seeing him and it kind of like completely changed things for me. And I was like,
There it is.
maybe I can do that. So, and he was very like, you have the personality for this. Like you have like the athletic background for this. Like you really should like pursue this. And I was like, I don't know. I don't know if I want to do all the schooling and all that stuff. And that was honestly like the biggest thing for me is between optometry. This sounds stupid, but between optometry and chiropractic is that with chiropractic, you don't have to do an entrance exam. Like you don't have to do like the MCAT or any of those like medical school tests and things like that, which optometry you did. And so I just applied for chiropractic school because I was like, screw it. I don't have to like do any test. And I got accepted. And then I was like, okay, I guess that's where I'm going. So that's kind of how it ended up.
I figured it was going to be something sports related.
Yeah.
Is what I figured it would be, like an injury or something like that where
Yeah.
you saw a chiropractor and they fixed you and you were like, yeah,
Yeah,
I
I
dig
think I
that.
need to do that with
Yep.
people. Yeah. Yep. Nailed it.
Yeah.
Yeah, we had never had that conversation before, which is crazy. But
No, you said you played softball and you
Yeah.
had talked about like a kind of a sports medicine thought process or something, like you were interested in that kind of thing. So I figured it came from a sports injury.
yeah. Yeah, and those are probably like athletes. I also really like treating pregnancy and like pediatrics, but athletes in general I think would probably be my favorite group of people to treat just because of that. So
What's the clientele difference looking like between the two practices?
well, my first day, a lot younger people, more fit people, I would say. The joint brings in a lot of people, like I said before, that don't take care of themselves, don't do anything outside of chiropractic care, which I try to educate people on that. Like you can only do so much in that room with that person. You can like temporary relieve their symptoms or whatever over time, but it's kind of up to that person. And we've had this conversation a million times. Like, it's kind of up to you. Like, you've got to do the stretches, you've got to do the exercises, you've got to do the icing, the heating on your own. I can't come home with you and do all of those things for you. I wish I could, because then I know it'd get done. But yeah, like the amount of people I see after the first visit and they come back and they're like, oh, I'm sore, blah, blah, blah. Okay, did you ice? Well, no. Okay, well, now I have to get on my soapbox and like tell you why that's important and all the things. So, yeah.
I was blown away at the other place. I don't want to drag the name through the mud so much, but like the other place, I would say the fitness level, the average fitness level there, or average just overall health, they didn't look like the kind of people that chiropractic would be on their radar even.
Right.
I don't know what your view is on the medical field. If you hear the last episode that we did, I told them that I wanted a doctor that hates doctors. Like, I hate the medical field.
Yeah.
I don't trust it. And most people that look like the people who frequented your prior place of employment, I'm really bad about stereotyping. Those would be the people that like
say it ain't
surely
so.
not.
No, he's not.
Made that one easy for you. A lot of those people are the same type of people who I envision being the ones to run to the doctor and be like, give me a pill for this. Give me a pill for this. I know so many people that way, and none of them are healthy.
Yeah.
It's everybody wants the quick fix, the quick fix.
Yeah.
And chiropractic for me has been both. When I started going and I started having migraines, like I've always had migraines, but I had a really bad episode of migraines where I had a headache for like 7 or 8 days. It didn't go away. It was something crazy. I walked in with a horrible headache. I left with some relief. I came back the next day and got adjusted again, and we worked it out. The headache was gone, and I started going fairly regularly. But the headaches didn't completely go away because I wasn't going every week, whether I needed it or not, kind of thing, or whether I felt like I needed it or not. I think you absolutely need it once a week. It's almost non-negotiable that everybody should be in a chiropractor once a week, whether you feel like you need it or not. I genuinely believe that now. There's been weeks where I've been in there to see you, 3-4 times in a week?
Yep.
If there's a problem, like, I'm there.
Yeah.
And you get the immediate relief. It feels better when I leave. But by the end of the night, it might be really bothering me again.
Yeah.
And so at that point, it's not just like the quick fix where it was good and it's fixed. It was relieved, but it's slipped back to causing the problem. We have to stay on top of it.
Yeah.
And then you eventually correct the problem, I think. But I think that also comes with some responsibility, like you were talking about. And, you're wildly familiar with the SI joint issues that I have. And for the longest time, she would just adjust it and it would do better, and then it wouldn't. And then I've started doing exercises on top of the adjustments, and it's kind of revealed to me what's causing the problem. And did I tell you about this? Like I started doing, so I use ChatGPT.
Oh,
you know,
yeah.
And I was like, I have this SI joint issue. It's really affecting my workouts. I need an exercise program to build stability around this joint. Gives me these exercises. I bring it in, show it to her, and she's like, yep, and add this exercise to it. And there was like 5 exercises to do in this routine. Should take about 15 minutes or something like that. I got through 2 of the 5, and I was fucking smoked. And it was like girly yoga stuff, dude, like hip thrusters and this thing called bird dogs.
Well, you haven't worked out your hip thrusters in a while.
Truth. Why do they got to be like this to me? Hip thrusters and no weight, just body weight.
Yeah.
And bird dogs.
Mm-hmm.
You know what those are?
Mm-hmm.
If it's not hard to imagine if you don't. But after 3 sets of 15 on hip thrusters and 3 sets of like 8 or 10 on bird dogs, I was smoked. Like I was shaking.
Laying in a pool of your own tears.
Just about, yeah, like literally shaking. And the muscles, like where the location I would use to describe it would just be like the top of my butt, like from the bottom of my belt to the top of my pocket line, somewhere in there.
Yep.
And it was just on fire. Like it's so weak. And that would be why, I told her that. I went in the next day and she always asks, like, how's everything feeling? I'm like, oh, pretty good. I started that exercise routine for my SI joint. And she was like, how'd that work?
Puddle of my own tears in 15 minutes.
Yeah. And she's like, that's why you're having the problem.
Yeah.
You know? So obviously foundational, but not a cure-all. Fair?
Fair. Yeah.
Okay.
Yeah, and that's kind of my philosophy on it, honestly, is I don't necessarily, like, there's some chiropractors out there that, chiropractic fixes everything. And I kind of, like, toe the line of, like, chiropractic and, like, medical doctor in a way where it's, like, chiropractic's not going to fix everything for you. And there's some people, it's, like, the same as surgery, medication, some people aren't going to respond well to chiropractic, and that's okay. Whereas like some people are like, no, chiropractic is the end all be all for everything. And that's just not how it is. There's a time and place for medication. There's a time and place for surgery. And sometimes those things are inevitable. And I think a lot of people like don't really understand that. They think that, and that's another hard part is when people come in to a chiropractor and they're just like, I just need popped this one time and it'll be cure everything. And I'm like, it might temporarily relieve it for, and everyone's different. A day, some people are good for a year, but inevitably it's going to return if you don't do, things outside of that as well. So, yeah.
No way you're good for a year.
Oh, God.
Like,
no.
there's no way.
Yeah.
They
No.
might think they are,
Right.
Yeah.
but you're
Right.
not good for a year.
No, this
Yeah.
is the longest I've gone without seeing a chiropractor. And I think I'm at like day 40 or so.
Okay.
And stuff's starting to.
Starting to feel it.
Yeah.
Yeah.
Like, we live in gravity.
Yeah.
Like, gravity is working on us all the time.
Yep.
So-
And
Like I know my kicker, so I went to. I'm not trying to cut you off. I'm sorry. I ended up going to Dale because I got hurt.
Yeah.
Had a big tear up here in my AC, and my primary care and the tribe was like, "Hey, you probably need surgery." I went to him, and he was like, "I can fix it without surgery. Let's just try it." I was
Yeah.
like, "Hey, man, let's just try it." And I tried it, and it got me unfroze my shoulder, helped all this, did great. And then what was it?
Yeah.
A year or two later, I got shit clapped by a tree, which is the nicest way to say it.
yeah,
A 55-foot hedge tree fell on me. I had 1 degree of rotation to the right and 4 degrees of rotation to the left
Wow.
in my neck. And now I can
Yeah, you're good.
go all the way. Same deal. I saw Dale, man. I don't even want to know. Probably in a year, I probably saw him 120 days of a year.
Wow.
But we got it fixed, and I have no reoccurring issues.
Yeah.
So I'm a firm
That's
believer in it,
Yeah.
but I know that it's not for everybody.
Yes. Yeah.
So I know, like, my biggest question was, like, why do people walk around broken? And I think that he hit it. I mean, mine's injuries, but, like, gravity in general. But, like, what's the normal injury that you see? Like, what's the reoccurring theme of why people are broken and they need chiropractic help?
Honestly, I would say it's more like lifestyle, sedentary lifestyle. I see a lot. I joke with people all the time. Like 90% of our patients that we were seeing at the last place I worked was like forklift operators, hairstylist, dental hygienist, those sedentary job, or not even sedentary necessarily, but like people that were working overhead, all the time. People's jobs play a huge role. I mean, you do your job, gosh, probably 75 to 80% of your life is your job. So I think that plays a huge factor into people's pain. And then again, sedentary lifestyle. People don't want to exercise. People don't want to eat healthy because it takes effort and it takes money to, exercise. Eating healthy is expensive. Cotton candy grapes are expensive.
Thank you so much for telling me how expensive those are.
Yeah, you're welcome.
They're really good though, and they're worth it.
You should try one.
Yeah,
I
you
mean,
should.
I'm not down. I'm not above eating some cotton candy grapes.
They're
Yeah,
probably still
they're
healthy.
Pretty fire.
They're really sweet and they taste just like cotton candy.
It'll blow your dress up.
Damn.
Yeah.
Yeah.
Yeah,
They're
life
different.
changed. They're like $8 for 3 pounds.
I didn't behave the best today. You know what I had? Chili cheese dog Cheez-Its.
So
They make those?
Yeah, I just saw them at Casey's for the first time and was like,
Were they
gotta
good?
try that. They didn't suck.
Walker
It's the shittiest thing I've eaten in like 58 days.
So I
but-
want to call her out on this. Forklift drivers,
Yeah, I was getting to some questions.
because
Is
our
that-
boy over here is a
is that
forklift
you?
driver,
Yeah.
and he
so-
claimed in our last episode that he gets 20,000 steps a day.
Not a fucking chance.
So if I do that one, yeah.
No, you
'Cause-
don't.
Yeah.
Bro,
Guaranteed.
I'm
No, you
gonna-
don't.
I'm going to put my
Guarantee
watch
it.
on you for a week, and I want to see what your steps are.
You don't get
It's an
20,000.
experiment.
It is
It's
an
a lot.
experiment.
I
It's
like
a
it.
lot.
It's
a
like
lot.
4 hours. No, it's more than 4 hours. There was a
Yeah.
dude on YouTube that did a challenge. Like I walked 20,000 steps a day for 30 straight days, and like this was the what changed in his body thing. It was that big of a deal.
Well, like I told him, and I mean,
It's hours.
we live a
Yeah,
different
well,
lifestyle. Yeah, we're cops, but like I'm stuck behind a desk.
Yeah.
Predominantly he's stuck behind a desk or in a car. So it's a push for
Yeah.
me to get 10,000 steps a day.
Yeah.
You're at least on your feet.
Yeah, I get a lot of steps in.
Yeah.
For sure.
She gets a lot of heave hoeing in on people. Like,
Yeah.
yeah, that's why I asked about the clientele at the new place.
Yeah.
Because
It's
at the
been-
other place, whenever you said that people's jobs were what was beating them up, I was like, no, it's fucking. Half the people in there don't fucking work. I don't know how they get to go to the
Social Security a
chiropractor.
job.
Yeah, it was
Yeah.
like, listen, I love that place because of what it did for me in terms of the affordability of it. You know, I was able to see you a lot and get some things lined out.
Yeah.
And it was affordable to do that. And I appreciate that about it. So nothing against the facility, but the clientele in there was like, listen, it wasn't because people were like linemen in there working hard. It was because they're like built like walruses, and
It was hard at the beach that day.
gravity has
Yeah.
fucked them. Like, yeah. And they're like, I don't know why my back hurts. Like, I would sit in the waiting room. I'd like take pictures of people in the
You're
waiting
like, I can
room.
tell you.
Like, yeah. Be like, you're at the chiropractor. It's the wrong place. A weight loss clinics down the road. But
I like
you'd get some 400 pounders in there.
Oh, yeah.
A lot of them.
Easy. Yeah.
Oof.
Yeah. A lot of them. Yeah. Yeah. I had like that move that I do on you. It's called the A to P, where I like
Can't
put
get
the
your
fist
arms
under
around
the
them.
back. And yeah, I mean, I just have 90% of the time just bruises just through my whole like chest, sternum, just because your elbows are like that.
Oh, yeah.
You know, and then you push down and get an elbow to the chest and things like that. But
Oh.
yeah, it's rough. Yeah, and nobody told me before I went to chiropractic school how like physical, and I'm stupid, like I should have known that, but yeah, it's physical.
I wouldn't have thought it to be like real overly physical, but when you're in there trying to kickstart somebody, like
Dude,
with the
Think about jujitsu.
Yeah.
You're trying to move a 200. I mean, she's tall, but she's a little thing, and she's trying to move a 200, 300 pound human.
Mhm.
That's a lot of torque that you're trying to move.
Yeah.
oh
Yeah.
that what's the The one where you lay on your side and twist your leg over. What's that move?
Side posture.
Side posture. Like that one usually, it's like trying to start a motorcycle.
Yeah.
Yeah.
You know, and she has to crank on that usually 2, 3, 4 times to make anything happen. And there's a lot
on you for sure.
that requires a lot of energy. Like you can feel it, you know.
It does.
And you do that how many times a day?
Well, we were seeing close to like on a busy day, getting up there like 95 patients a day.
You personally?
Not me.
Okay.
Like as a clinic.
So what was your personal?
Oh, I would say average was like 40, probably 40 to 45 a day.
Jesus.
Yeah.
Kick starting a motorcycle 45 times a day.
Yeah.
Like three kicks on each side, though.
Yeah.
You know.
Well, that was it. So like, Dale's boy,
Yeah.
Ethan, he came to the practice and nobody wanted him to adjust him. And I was like, whatever, I'm here.
Like, yeah, I'll take it. Yeah.
I'm like, if you don't do it right, I mean, I literally told him, I was like, if you don't do it right, your dad will. Doesn't
Yeah.
affect me any.
Yeah.
And I felt weird, and I guess I always tell them I don't think I'm a big guy. 6'6", 250.
No, yeah.
I don't feel like I'm a big guy, but they tell me I'm what am I?
Fucking Jolly Green Giant.
Or like a Great Dane, that I think I'm like a lap dog. I feel like I'm gentle and nice, but Ethan adjusted me like the first 3 times, and I love the guy. He's super nice, but his hands would just get so clammy. I'm like, buddy, are you okay? He goes, dude, you're the biggest guy I've ever adjusted, even through school or anything. So it's just hard to get used to that. I was like, oh,
Really?
okay.
Yeah. That's crazy.
So I liked it when he adjusted me.
Oh, I do
I
too.
liked it better than Dale, actually.
I'm 50-50.
He did some things that Dale doesn't.
Yeah.
And I think that I do say a lot. The go fuck yourself. Here it is again.
Yeah,
It's going to be super self-conscious about it now, and it's going to make my conversational flow really awkward.
even more awkward than it was. There's always a long gap, and then another long gap.
Just roll with it. It's normal conversation.
Yeah, it's fine.
So, old school chiropractic versus new school chiropractic. Is that a thing?
Yes. Very much so.
Pray tell.
Is that where your crazy witch doctor stuff is?
Right. No, honestly, for the most part, I would say it's like pretty similar. There's some different techniques and stuff that like the old school, you know, and people still use it today. It's just not as like common, like SOT blocks. I don't know if you've ever like seen any of that done where they'll like put blocks under your pelvis and like adjust you like that. Have you ever had that done?
Mm-hmm.
Yeah. Yeah. That's like, I wouldn't say like more of an old school technique, but something that I don't feel like a lot of people do nowadays unless they're like specialized in that. Like that's something that you like a class you can take in school is like SOT, which I never took, things like that. But for the most part, I would say at this point, it's pretty similar to like people that are still practicing. It's pretty similar.
What about that one cat on Facebook or on Instagram that uses the hammers? He's got like the chisel and the hammer, and he's fucking whacking on people with it.
Hits you in the tank with a rod and a
Yeah.
hammer or whatever.
Yeah.
That's interesting. I don't even know what that would be called, if I'm being honest. We don't learn, like, you don't learn that in school. I don't even know what that is. That's like more towards like the people that give chiropractic kind of a bad name, in my opinion, like the quacks of, you know, chiropractic.
Super high profile clientele.
Really?
Yeah. Like professional athletes and such.
That go to him.
Mhm.
And honestly, I don't know enough about it really to
Maybe if you're trying to adjust a lineman's shoulder,
Maybe,
you're not strong enough and you have to use
need
that.
to chisel and a hammer.
He busts out like a big mallet, like these big plastic mallets, and some kind of
I'd run the other
thing
way.
that digs in there, and he'll quack.
That's crazy. Yeah.
Have you not seen him?
I
You don't know who I'm
haven't.
talking about?
Uh-uh.
I want to say his last name's Hightower.
I don't know.
Hang on, I'm gonna find him.
Yeah, no, I don't think I've ever seen that. But that's wild. I was watching these, I don't know like what country it is, but these videos have started popping up on my feed where like they put like a strap around your neck and they like crank you up. Have you seen those? And it just like distracts people's heads and like you can hear like, but people are like, it takes you to a point where like, if you go any further, like you're going to take my head off.
Sever it.
Crazy. Yeah. You're going to decapitate somebody.
Now, like I will hang I will put like a strap around the back of my neck and I
Yeah.
will just sit and hang, and oh, that feels so good.
That's good. Yeah. Do you do it on like a door frame?
Mhm.
Like, is it a, yeah. Did you buy that device?
No.
From him? Okay. I was
I've
like,
got
because he
one.
makes those. I'm
Yeah,
pretty
he makes
sure.
he makes something. I mean, I just kind of made my own, and it works.
Yeah. Hey,
Yeah,
cheaper that way.
100%. Well, that's
Yeah.
I don't always go for cheaper. The older I've gotten, buy once, cry once. But affordability, like you said, at the
Yeah.
joint is one thing. And I mean, so for me, and we've taken baby a few times,
Yeah.
it's $150 for us to go see him. As like I get adjusted, she gets adjusted, baby gets adjusted. I'm like,
Yeah.
God,
That's
dang.
crazy.
Yeah. Doesn't take insurance or anything. So
Really?
yeah,
Okay. Yeah. Do you have pretty decent insurance?
really good insurance.
Do you?
Yeah.
Okay. Well, pop over.
Okay, so that means we're gonna have that at the end. I want you to plug your stuff and
Yeah.
get you there.
For sure.
So most of us are decent at jiu-jitsu, and we do that, and we do hard
Yeah.
things like work on forklifts. And
Hang
I
on, hang
yeah.
on.
I sit
hang
behind
on,
a desk.
hang on.
Don't do that. Don't
When you say
we're
most
decent,
of us
like,
are good at
don't-
jujitsu, like
Yeah.
there's
He
one
means
out of
him.
three
Yeah,
here.
he means
like,
him.
no, I mean like if there's 4 of us in the room, 3 of us are pretty good at jiu-jitsu because we go. She probably has never gone.
2 of us
Never.
are not good at jujitsu.
That's true.
Okay,
He's being friendly here.
it's fine.
Whenever I come in all fucked up from jujitsu, it's him that did it most of the time.
Oh, is that what?
Yeah.
Okay.
No, see, this is that Great Dane thing. I'm so nice to him. He elbows me in the ribs. He hits me. We're not supposed to hit.
I
Yeah.
have hit
He
him.
does that.
And
yeah.
you just let him.
Yeah.
He busted one of my teeth the other day. I have a broken tooth now.
Whatever.
Dang.
Hmm?
Whatever.
I have a broken tooth.
Oh, okay.
I need to get a mouthpiece.
You do. Huh. Look at you. I
Yeah.
bit through my mouthpiece whenever you kicked me in the side of the head.
You had
so,
it coming.
Yeah.
I don't feel
Uh,
bad.
I've thought about doing. How do you feel about jujitsu?
What do you mean?
How long have you been
It's-
doing it?
I started in like 2017, and then I've had a
Okay.
couple breaks in between.
Okay. How often do you go?
2 times a week.
Okay. It's pretty good.
Yeah.
Pretty solid.
It's a good physical activity.
It's the
Yeah.
best, worst decision we make in a week.
Do you go to?
It's
Okay.
hard, especially
Yeah.
being built like a prepubescent boy. But
Yeah,
it's-
everybody in this
it's-
room is bigger than you.
Yeah, it's the best, worst decision that I make in
Yeah.
a week.
Okay. I've thought about it. Do you guys have women that come to you, or is it an all men's
No,
group?
there's
There's girls.
quite
in
a few
there,
girls. And they're mostly
Okay.
bigger than Colton, so it works out.
Okay.
and they beat me up. so
Yeah.
it's super fun.
Hey.
It'd be fun to try.
Yeah, I might need to. Might need to try it out.
Get in there with us. It'll be a good time. It's a good
Yeah.
time.
Get my ass kicked.
You will.
Good news,
Fine.
you'll build some clientele.
That is true. That is true.
That's the other hope
Boy.
with this thing. Predominantly gym members listen to this, so
Okay.
the hope is we can push some people your way and
Yeah. I would
show
love
them
that.
someone who could take care of them. But
Heck yeah.
coming would also help too.
Yeah.
Give it a shot.
I might have to. And it's every day, isn't it?
Yeah,
Technically. What
Um,
days do you normally go?
Tuesdays, Wednesdays is
Mhm.
Predominant
Tuesdays and
days?
Wednesdays.
Yeah.
Okay.
Those are
Okay.
kind of our non-negotiables. We're going to be there Tuesday and Wednesday. Other days are
and
we feel
Hit or
like
miss.
it's something good to get your kiddo in when he gets
That is true.
4, 5, 6-ish.
That is a good point.
Dude,
Yeah.
Yeah. Protect himself.
if you go like before the adult class and you see some of the kids class, you'll want him in there.
Is it
Oh,
pretty cool?
It's
100%.
great.
Yeah.
That's
Yeah.
awesome.
It's
Yeah.
great.
I did karate as a kid. Taekwondo, actually.
Yep.
Yeah. Didn't get far in it, but I did it.
Yeah. It's a fun sport.
It's cool. Yeah.
Jiu-jitsu just makes kids not meaner, but it makes kids,
More resilient.
yeah, I think
That-
resilient.
and
It's just
it's a
tough.
huge confidence booster too.
Yeah.
Yeah, like when you finally do it and you finally like
Yeah.
pin
Yeah, well,
somebody.
learning and understanding that, like, even though you may be smaller, like, you have the ability to defend yourself.
Yeah.
Like, if I run into him on the street, like, I'm just gonna go the other way or I'm gonna shoot him. But like people, maybe Walker size or somebody that's not Trent, it's like it's not even so much winning a fight; it's you can keep yourself safe.
Yeah.
That's
Yeah.
the main thing.
Yeah, that's cool.
And it might teach you some cool leverage for chiropractic stuff.
Yeah. That's
I bet you would be mean when you came in there because you know how to manipulate joints in the body.
I don't know.
I bet it would be.
Maybe.
She could probably make up submissions as she goes.
100%. She's like, oh, I know
Trigger
this joint's not
points.
supposed to go this way.
I like it.
Yeah.
Yeah, hit him with the trigger points. all
Oh,
things,
like the
pressure points.
right.
Mm.
That could be a thing.
Yeah.
Could totally be a thing.
All right. So you said people's job is like the number one thing that brings them there.
I would say, yeah, people's jobs, sedentary lifestyle. So, I mean, we do get like the injuries and things like
Yeah.
that, but I feel like it's not typically like, oh, I got hit by a car or something like that. Like injury wise, it's
Okay.
more like I went to pick up my kid and my back, gave out on me. Things like that aren't really like injuries, but more just like you're living your life and your body's trash.
So how about
Type of thing.
I know you said sedentary, high stress jobs, because I would be willing to say that a couple of us in this room have a high stress job.
Yeah, absolutely.
What does that play? Like, does that affect different than just a normal sedentary job, or?
Yeah, I would say it affects people differently. But a lot of stress, and I've noticed as I've been in practice longer, I feel like that men and males and females, they tend to hold their stress like different places. Like females tend to hold it more like neck, upper back, whereas men typically, not always, but typically hold it more like mid to lower back, in my opinion, from what I've seen. So I do, yeah, that definitely plays a huge factor in that. And yeah, you guys have super stressful jobs. So
Depends on the day.
yeah.
When you say hold their stress
Yeah.
in different areas, what do you mean?
Like muscles, like muscle groups, like yours, more like, lower back, glutes, things like that, piriformis, all of those muscles. And the piriformis muscle is a huge muscle that contributes a lot. So everyone has like a different variation of your sciatic nerve. Some people have a variation where it runs through that piriformis muscle. So anytime anyone has like tightness in your piriformis, which is basically your butt cheek muscle, it sometimes can pinch off like where that nerve supply is. And so a lot of people experience sciatic pain. And you've had a sciatic issues, haven't you? Before it's
Not
always
yet.
just been SI, no like pain down the leg, things like that.
No, some.
Some.
Or it
yeah.
goes, it feels like it fatigues
It's just weak.
really quick. Yeah.
Yeah. Yeah.
She knows my body.
Well, I really appreciate you dumbing it down, because I did, A&P 101 and landmark A&P, and then I gave up because
Yeah.
it got really tough. So
It's
thank
rough.
you for
Yeah.
saying but.
Yeah.
These are
Run
the kind of
through
terms that
butt.
we all know.
Yeah, exactly. Yep.
All right, so when you're doing
So-
a chiropractic adjustment,
Yeah.
give us the overall what you're looking for. It's not just like come in, lay down, I'm going to pop you. You say you like your new spot because you get to spend a little bit more time. Kind of walk us through what those look like.
Yeah. So typically, like just going for like chiropractic adjustments from start to finish, typically like you start off with a new patient exam. Obviously, in the new patient exam, basically what you're looking for is like when the pain started, how the pain started. What makes it better and worse is actually a huge indicator. Like if people say heat makes it better for them, typically it's probably more muscular. If heat makes it worse for them, typically that's probably not the case. So those are like things that kind of like ring a bell when you first initially do that. Then you take people through like range of motion, just like how you're talking about your neck had like 4 degrees on one side and 1 degree on, the other. That helps to kind of indicate like where restrictions are as well. And then you typically take people through what we call orthopedic tests. What orthopedic tests do is they help to determine like what structures are being affected. So, like in Matt's case with like the lower back SI pain, we're more looking like when we do lower back orthopedic tests, we're looking, okay, is this test is positive for this, so in this test is positive for this, and it's kind of just like an indicator of like, okay, is your pain more coming from like your lumbar spine, or is it more coming from sacrum, pelvis, those structures? Everyone always comes in and they're like, I have hip pain. Okay, is it actually hip pain, or is it coming from like your lower back, and you just call like everyone calls that back area like your SI joints, their hips. And so that just kind of helps us determine like, okay, is it actually your hip or is it more your lower back? And then after you go through all of that, typically you like lay the patient down, you'll do more of like a palpation. What you're feeling for with palpation is everyone should have a little bit of like a spring to their joints, right? Everyone should have like a little bit of a give. Any of the areas that we go through and we're checking, we're like, ooh, that doesn't really feel like it has, as much give as it should, or as much give as the other side does. Those are the areas that you have to go in and adjust and get more like motion into those areas. So that's kind of what you're looking for. And I know a lot of people ask like, okay, well, how do you know like what areas of the spine or like where like certain restrictions are? And honestly, it just kind of comes with time. I'm going to be honest, like the first year that I was in practice, like I felt like I didn't know anything. Like I was just kind of like, you just kind of like fake it till you make
Throwing
it,
shit
right?
at the wall, hoping
you
what
just,
sticks?
yeah, you're like, okay, I think that this feels like how it's supposed to feel, and then you just adjust it, right? But as you kind of work on, and you know, working at a high volume practice gave me a lot of like feel with my hands to where now I can actually feel like where like the restrictions are. And it's like a weird feeling. You can look for muscle hypertonicity to like kind of do that. You can feel TVPs of the spine, like the little things that come off of your spine. Sometimes if there's like a rotation in the spine, sometimes you can feel those. Here and there, they kind of feel like little like M&Ms. Like if you're feeling like the neck, you can kind of feel like the little M&Ms on the sides, and those are the areas that you know you got to go in and kind of adjust those. But yeah, it's mostly all just feel, really, and it just takes time. So yeah,
It takes you about 0.2 seconds to find the problem when I walk in.
yeah.
Whether it's because you've just in general learned to recognize where to go based off of a description, or because you figured out what's going on with me.
Yeah.
You know, but what's going on today? You got a headache, don't you? You know that when you see me or whatever. You know my
I can
back
see
is
it in your
bothering me.
eyes. Yeah.
But then I'll get on the table and you'll go right to the spot. The correct side, the neck is bothering me, and the exact location. And
Yeah.
it feels like she's digging in trying to kill me, and I'm sure that the pressure isn't that intense, but it
Yeah.
obviously feels way worse when you're prodding
in it.
around
Yeah.
on an area that's aggravated.
Yeah.
So how do you recognize, it's immediate. You go straight to the spot.
Yeah.
Is that just time and, this is where most headaches happen type of thing, or?
Honestly, yeah.
Just tell him he's special.
Yeah, you're special.
There
Yeah.
you go.
And I've seen you a lot. So
Right.
like at this point, like I know exactly what's going on. But yeah, for the most part, for people, it's just feel like I just know. Yeah. And a lot of the times, like, people give you like indicators like, oh, it's, the right side of my neck way up under like the skull. And then I'm like, okay, well, I only have like 2 areas there that I like need to feel before I probably know what's going on. So yeah, it's honestly just time, feel, experience with certain people. And there's still people that I see like their first visit and I'm like, okay, well, you're saying you have lower back pain, but like your pelvis and everything kind of feels okay. And it's just kind of getting to know that person over time that really helps, honestly. So, yeah.
What are some things that people come in for that like chiropractic isn't the answer?
I would say like the number one thing that we get is like a dislocation. Like people will come in with like a dislocated like kneecap or something. And I'm like, okay, immediately you need to go to the emergency room. Like that is out of my scope of practice. Like we don't do any dislocations. There's a fine line between what's a restriction, which is what we treat, and what's a dislocation, which is like immediate referral. And sometimes it's hard, looking at somebody and they're like, oh, my shoulder feels like it's dislocated. And it's like, you do tests to make sure that it's not. But sometimes it's kind of hard to like determine really like, okay, is this dislocated or is this just a restriction, But I would say that's like the number one thing that we get that's like a red flag, that immediate referral. So dislocations. Yeah. Shoulder dislocation, hip dislocation.
Like sports injury style normally?
Sometimes, yeah. Or like, honestly, for the most part, we get it from like people that are working. Like I jumped out of my truck and like, my hip dislocated or whatever.
Cool. Yeah.
And you get those calls and you're like, okay, is your hip actually, like, just come in, I guess. Like, come in and we'll check it out. But 99% of the time, it's probably not actually dislocated. People are just, over exaggerating what they're, experiencing.
If they had a dislocated hip, they couldn't walk, could they?
Exactly. Yeah.
Like it wouldn't be possible.
Come
Would it?
drag it
Yeah.
in.
Exactly. Yeah.
Yeah, I'd be in a wheelchair.
Yeah. And I'm like, some of the people, I'm like, you might have dislocated your hip, but you probably like reset it somehow if you're walking in here. Or shoulders, like people will walk in with their shoulder like, hanging down off their arm, and I'm like, immediately, yeah, you're gone.
I honestly probably would have gone to you if I
Yeah.
thought I had something dislocated. They're like,
Dislocated.
oh, she'll put it back.
Yeah.
Yeah, and that's what a lot of people think. And I'm like, nope, that's
Why not?
out of my...
Why is that not a chiropractic issue?
I don't know, honestly. I don't know why.
I feel like I trust in chiropractor more than I trust an ED resident to do that.
To pop,
Yeah.
to pop your shoulder
Yeah.
back in or whatever. Yeah. Yeah, I don't know. They don't teach like resetting joints. We don't learn any of that. Like, because there's a certain way, you know, when your shoulder's dislocated or whatever to reset it. And I think it honestly probably comes down to like medical doctors versus chiropractic. Like in general, our medical doctors are seen as more, I don't know what the right word is. I don't know.
Real doctors.
Yeah, like real doctors.
I wasn't
yeah,
going to say
no.
it, but yeah.
No, that's exactly what I'm talking about. Yeah, they're like real doctors. So when there's something like serious like that, I think that, yeah, people just want them to go to a real doctor.
So is there a hierarchy?
All you need
with
is
doctors?
a file cabinet. Everybody knows that.
100%, or that wall right there. That
Yeah.
wall's
Have
reset
you
my
seen
shoulder a
Lethal
couple
Weapon?
times.
How many times did Mel Gibson fix his shoulder when he dislocated it in Lethal Weapon?
Every time.
All the time.
Yeah.
You've not seen Lethal Weapon, have you?
I bet neither
Too
one of
young.
them have.
Have you seen Lethal Weapon?
I have not.
Jeez. These kids.
I know. How old are you?
29.
Okay. Nice. I'm 28. Just turned 28.
Look at
Yeah,
that.
I
This is your
know.
birthday present from us.
Thank you.
Yeah.
Cotton candy grapes.
I love it. Candle.
Strawberries.
Candles.
Setting the mood.
Yeah.
High exposure, at least
Yeah.
30 listeners or something.
Oh,
like
yeah.
that, you know?
Crush it. Gonna crush it.
So you brought up a good point, something that I think it would be cool to address. What's the disconnect between chiropractic and the medical field? A lot of doctors, real doctors, I'm doing the air quotes thing,
Yeah.
will tell you that
They're just
chiropractic
quacks.
is quackery.
Yeah.
I think that's bullshit. I think it's complete bullshit. I think that a medical doctor is a real doctor for their field, and I think that a chiropractor is a real doctor for your field.
Yeah.
Two
Yeah.
completely different things that deserve I say equal respect. I think I have more respect for chiropractic than the medical field.
Yeah, because you guys have to do everything without medicine.
Yeah. Yeah. So I think a lot of that honestly comes back to, so chiropractic, like the history of chiropractic, it's actually pretty new. Like I don't remember the exact, gosh, I should know this because it was definitely like a test question and a board question, but I think chiropractic, it started in like the late 1800s, I want to say. So it's like in the grand scheme of things, it's like pretty relatively new. And I think a lot of that comes from the newness of it and the fact that like when chiropractic started, a lot of the early chiropractors were actually arrested and like taken to prison for practicing chiropractic. Yeah, I don't know if you knew that. That's kind of like the cool history behind it. Yeah, like all of they did like speakeasies like back in the day where like chiropractors, they would have like a chiropractic office in their basement and like no one was allowed to know about it because it was like super illegal. Like nobody could practice chiropractic. It was like against the law. And like all of the like early like founders of chiropractic, like all were in like, yeah, ended up in prison or arrested probably at some point, I would assume.
Wow.
That gives me even more respect for it.
For sure.
Yeah. Yeah. Like it's crazy. Some
Yeah.
of the history, like learning, we had to do like a chiropractic, history philosophy class that was actually taught by Dr. Cleveland at Cleveland, which was really cool. And yeah, like I want to say like his whole family, grandfathers, great grandfathers, all those people were all chiropractors. And yeah, they were some of those that were arrested or had to kind of keep it low when chiropractic started.
And this would have been when? When was this happening? Late 1800s?
Oh, she's
Let
going
me
to have to
look. I'm looking it
Google
up.
that.
Well, my great uncle graduated from Cleveland Chiropractic, and gosh, it would have been
Well, God, you're
probably in the
70,
1940s.
so
Yeah.
you know?
So chiropractic became a distinct profession, was founded in 1895.
Wow.
Yeah.
So it is relatively new.
yeah, so it's not that Chinese mysticism stuff that a lot of your doctors will tell you.
Yeah, and I think that's a huge, like, that's where the disconnect is that they just don't think, because obviously medicine modern medicine has been around for
Ever.
literally forever. Yeah. And so they have like a lot of research, a lot of case studies, all those things that, point them in that direction. Whereas chiropractic's getting there, it's getting more case studies, it's getting more research and all of those things, but it's just not quite there yet. It's just one of those things with like evolution of time, people start understanding a little bit better. And I think that's a huge thing is patient education, because a lot of patients don't understand what chiropractic is. And a lot of chiropractors don't do very good at patient education, and like, understanding of what it is. So,
well, there's a good question. If you were going to educate a new patient who was listening to this, what would you tell them?
oh God,
You got somebody sitting at home with their back hurts when they're sitting at the supper table every night or sitting at their office chair every day, and they're considering chiropractic. How would you pitch that to them?
Yeah.
Like, how would you explain chiropractic to them?
Ooh, that's a really heavy question. I would say, chiropractic is a profession that focuses on, the whole premise of chiropractic is the nervous system, right? So, adjustments in the spine, basically what we're doing is putting functional movement into the joints, and so that your nervous system can communicate better with the rest of your body. Like you said, with like, it starts with your brain. You've got like a highway, that's your spinal cord, and then all of these little back roads that come out of all your extremities, and everything's connected. And I think that's the cool thing about chiropractic too, is that the direct effects of chiropractic, obviously like more motion, range of motion, mobility, pain relief, all of those things are like the direct, effects of chiropractic. But the nervous system also, supplies innervation to all of your organs, all of the other things that sometimes can be an indirect effect of chiropractic. We can never say like, chiropractic can cure your like digestive issues, or chiropractic can cure your thyroid issues and things like that, because not necessarily true, right? But sometimes it can be an indirect effect because of those nerves are, the nerves are like, the pressure's taken off of those nerves, and it allows communication better with those organs and things like that. And so sometimes that can be, part of it. So, yeah.
Yeah, I would say you can't necessarily claim that it can cure, whatever with your thyroid or whatever the issue may be. But I don't think someone in the medical field would be able to claim that chiropractic can't cure that either.
Right.
Because the interruption in the signal from the brain to the nerve that affects what organ, that signal being interrupted could very well be the problem.
Yeah,
right?
Absolutely. Yep.
Again, back to it being, I believe, foundational. So if I'm going to the doctor, the medical doctor, for treatment for
The real doctor.
Yeah, to the real doctor.
No, I agree. So, I mean, the foundational portion, as we're sitting in the basement of a house that was built in the 70s.
If the bones aren't right.
Right. So if the foundation's screwed up, the rest of the house is going to be screwed up.
Right.
So if their back's screwed up, they can go get on whatever pain meds and do whatever they need to do. Their back's still going to be screwed up. No matter what we change, it's still going to have an issue at the root of it.
Yeah. Yep. And I think too, like, the psychological and like mental, emotional aspect of chiropractic is really, really cool too. Like I was thinking when you were talking about that, like veterans, I used to treat a lot of veterans, and the amount of veterans that we had, because the VA, I don't know if you've dealt with the VA at all, but like very difficult to work with, don't give like visits out lightly for people. And so I've had people like veterans that they're like, this is the only thing that helps my, PTSD or, things like that. And they're like I've had veterans crying in my office because the VA won't give them visits. And they're like, I would rather have this $30 visit than a $300,000 surgery, that they like immediately would give them the $300,000 surgery, but they won't pay for this $30 chiropractic appointment. And that's all they want. Like they don't want anything else other than to just feel better, and it just helps them mentally, emotionally, all those things. So that's crazy. But
so have you seen that? I'm sorry.
Go.
Have you seen that the pain? So I have a friend whose family, I'll be as general as I can. A lot of injury up in here, had to end up having a surgery to remove some bone up there.
Yeah.
But all the pain caused them to get to the point of attempted suicide, because they were like, hey, the pain is so unbearable.
Yeah.
Is that something chiropractic, like you've seen in chiropractic?
I have, yeah, unfortunately.
Yeah.
And we have like questionnaires that we'll ask people sometimes. They're called like yellow flags. And that's more like mental health stuff. Like I had a patient today who had a couple of yellow flags on there, like, and it'll pop up as like an alert. Like if we ask someone like, does your pain like cause you sadness? Does your pain like allow you to not do things, you know, that you want to do in your life? Does the pain, you know, take you to a point where like you want to end your life, you know, things like that. And those are, you know, definitely things that we take heavily into consideration when we're treating people. Because yeah, pain is definitely something that, you know, causes people to get to that point, which is really sad. But I've seen chiropractic help, you know, a lot of people that feel like they are lost, like they have no, you know, way out. And even, you know, chiropractic might not fully fix those people. Like you might not have 100% fix where, you know, you have a 70-year-old veteran coming into your office that their body's been through some stuff, you know, they have a lot of trauma. So we might never get them from, you know, a 10 out of 10 to a 0 out of 10. But even if you could get somebody from a 10 out of 10 to a 4 out of 10, I mean, that's a huge like change in their life. Yeah. So, yeah. And I tell people that a lot, you know, I might never get you like Matt. I might never get you to the point where you have zero pain and you feel like you're like 18 years old again, right? But maintaining where you're at so it's not getting flared up to, you know, 8 out of 10, 10 out of 10 where you like can't function throughout your day. That's huge for people.
Yeah.
So.
And I know like personally I asked that because
yeah,
that plus mine, I mean, like if I went and saw Dale and there's a doctor here in town, he actually lives right there. I went and saw him twice because everybody highly recommended him before I went to Dale. And he was like, dude, I can't fix you. You're like this. This is how you're going to be. And then I went to Dale and I was like, man, if Dale told me the same thing, I would have gone down a really slippery slope of like, I don't want to live my life if that's like constant pain every day. And the most you can turn is just turn your shoulders. That's not really a life worth living. So if you can help somebody even with a little bit, I think that would be a big thing.
Yeah. Yeah. And that's what I'm excited for this new, like my new job is because like the last place, the chiropractic adjustment gets you, you know, some people can't tolerate that. Some people can't tolerate like a full on like manual adjustment, you know, but like some modalities, even like E-stem, ultrasound, you know, some of those things where like people can't tolerate, you know, all the pushing and the force and all of that stuff. Like, and some people, you know, they can't have that. Like if they have, like I've seen a lot of people with like rods in their spine, and I'll still adjust people like that, but it's just a different approach. You know, you have to approach that with a little bit more grace, a little bit more like fragile with those types of people. But yeah, I see people. Yeah, I had two people that have full on like their whole spine is a rod because of their scoliosis and things like that. Yeah. And I think that's one thing that the joint did give me is I've had a lot of people that come in and they're like, the last person that I saw told me that they wouldn't adjust me because of this. And I'm like, that's crazy because I'll adjust you right now. Like, I don't care. But we take a different approach to it. Like you can't fully shut somebody down because they can't tolerate one adjustment when there's 900 million different things that you can do to help them. It might not look like what they want, you know, everyone wants their whole spine to pop like a glow stick, right? But some people just that's not what they need. And so it's just kind of like meeting people where they're at and kind of tailoring the treatment to what, you know, those people can tolerate and what they can handle, I think is huge. And some chiropractors just don't take the time to do that, which I think is sad.
Well, chiropractic in the United States, from what I've seen, is very much the push as many people through as you can.
Yeah.
Get their copay, get the cash, and then on to the next. Tell them, hey, you need to see me 3 times a week or 3 times a month or whatever. Not knocking any of those practices, but that's the general of how it kind of runs is come see me more, I'll make you better, give me money, and it'll fix it.
Yeah. Yeah, and that's one thing that I'm not in the profession to make money. Like if you're going into chiropractic to make a lot of money, it's the wrong profession for you because newsflash, it's not like I thought I was going to come out of school and make like what an MD makes.
Should have been a real doctor.
That is, I should have been a real doctor. Yeah, that is not the case. So, and I mean, I'm sure some private practices do make, quite a bit of money, but that's not why I do what I do. I think a lot of people go away from that where they're like, yeah, let's just like pop as many people as we can and get them out of here. But in my opinion, like if you spend more time with people, if you take care of people the way that they, deserve to be taken care of, you listen to them. I think that's one of the biggest things that I hear from people is like, my chiropractor, like I told them I came in with shoulder pain and they didn't even touch my shoulder. They just did the same thing that they do with every single person and it's boom, bam, and I'm out there. And I hate that because that's just not how it should be. But it kind of has turned into that. And I'm excited for the new place because I feel like I can spend a little bit more time with people. I like to talk to people, like not even about necessarily like their symptoms and their pain, but like about their life and like getting to know people on a more like deep personal level, I think is really important. Like some of the older people I see, I am the only person that they see in an entire week. And if I could spend 15, 20 minutes with that one person to like get them through their whole week, like I will block my schedule out for an extra 20 minutes and not see 3 other people so that I can do that. Like, I just feel like that's how it should be.
Tell me she's not a bad motherfucker.
Dude, 100%.
Yeah.
So we normally end by like, tell us the why of what you do. But I mean, I
Yeah.
think you pretty much summed it up right there.
Yeah. Yeah. I like what I do. I've had a lot of nights where I'm like, and I told Matt this the other day, like there's been times where I go home and I'm like, damn, did I like impact a single person today? And Matt was like, if I came in, you did. Like, and I'm like, I appreciate that. But like
100%.
Yeah. There's days where I'm like, damn, like I feel like I didn't do anything for anyone and I'm trying so hard. And there's been like countless nights where I like go home and it's dumb. Like I shouldn't do that. But like I go home and I just think about like so-and-so, like I'll have 50 grade adjustments for the day and I'll have a one person that like, maybe it didn't respond well or, they're not getting better. And I'm like racking my brain like, okay, why aren't they getting better? What can I do to like make them feel better? Like I spend a lot of nights just sitting there being like, I hope that I'm impacting somebody's life, but I don't feel like I am.
Do you ever get to hear the wins?
Yeah. And I do. And I'm like, I'm a person that's just really hard on myself. Like you could tell me I'm amazing a million times and Matt could come in 3 times in a week and tell me I'm the best person ever. And then there's that one person that like ruins it, that's like, man, I suck at what I do. But
most good, hard charging type A personalities are hard on themselves.
Yeah, that's me for sure.
Yeah.
So yeah,
I get it.
It's rough, but overall, yeah, it's been good.
Well, I've never heard anybody say a bad thing about you.
Oh, well, I appreciate that.
I can't say enough good.
I know that's my thing.
I literally can't say enough good.
I know 5 of the guys that come to you, and everybody has raving reviews.
Yeah,
yeah.
Your whole group of friends is like you're my people. Like I love your guys' friend group. I'm like I still need to go hunting, so everyone's like, yeah, we'll take you hunting. Ethan's asked me to hunt. You've asked me to hunt. I don't think I talked to TJ about it, but
he would.
Yeah,
you probably
welcome.
shouldn't. You can, but you shouldn't because you'll have to block out the rest of your day.
Right. Jeremiah, all those guys. So
yeah, if you ever want to go, all you got to do is say the word. I know somebody. Yeah. I mean, I'm definitely willing to take you, obviously, and I know the other guys would too.
Yeah.
Do you eat wild game?
I do not. I have never eaten like deer meat. No, never eaten it.
Turkey?
Never tried
Are
it.
Are you willing to?
I'd be willing to.
I 100% guarantee we could throw on some backstrap.
Well, I'm like, I got a turkey right in there right now that I'd give to her and tell her how to cook it, or we'll cook some and take it over to her.
Yeah, I don't think wild game is something that you send somebody home with. And
right.
Like, well,
just cook it. Yeah. Set it on 450. You're good.
Right.
Yeah, okay. We'll cook it and we'll bring it to you then.
Requires a little bit of extra attention.
Yeah. I'm a little bit weird. Like meat's a weird thing for me. I have a hard time with meats. I'll try it.
Okay.
And especially like deer jerky, like I have a really hard time with beef jerky because that's just a past trauma situation. But I'd be willing to try it.
All right.
Yeah.
You can get,
we can do this. I think some back straps wrapped in bacon.
Oh, yeah.
Yeah.
jalapeno, cream cheese.
Yeah.
You know,
Oh, or just some of the burgers that we used to make when we were processing them.
I'd go backstrap
Yeah.
for sure.
Those burgers.
You just
pretty good.
can't go wrong with the backstrap.
I agree.
Yeah.
One more question I have for
Yeah.
you, and then we'll kind of wind this down. I know you've got a family at home and stuff
Yeah.
to do. You talked about you enjoy like adjusting. You had like a kind of range.
Yeah.
You said like athletic or people that work, and then moms and
Babies.
Babies.
Well, yeah.
Kiddos,
Pediatrics.
right.
Yeah. Yep.
I am new dad.
Yeah.
Give me your pediatric thing, because Chloe got adjusted during pregnancy and stuff.
Yeah.
Helped a little bit. She had preeclampsia.
Oof.
Doc kind of set us straight on that and got us lined out, but
Yeah.
wasn't much we could do for it. It just happened.
Yeah.
But little man had colic really bad, and we got adjustments for it. And like
Wow.
I told them, like instant fixes.
Yeah.
So what else can I expect with pediatric adjustments?
Yeah, so colic's a huge one. Bowel or bladder issues is a really big one with kiddos too, like constipation.
So if he's backed up for like 7 days, come
yeah,
see you.
take him in. Yeah,
Okay.
for sure. That helps, like sacral pelvis adjustments. And obviously you've seen your kiddo get adjusted. And I think that is probably one of like the biggest misconception of chiropractic care for pediatrics is they're like, I don't want my kid to be, popped, snapped. And then like, that's not at all. Like it is very different than like an adult adjustment. Like we're not doing any, like if I hear a single pop out of like a kid that's, a year or younger, something's wrong. Like it's more of like sustained contacts, is more like, I always tell people it's kind of like the pressure you use to check like an avocado. Like if an avocado is ripe, it's kind of that like pressure. So yeah, colic, bowel or bladder issues. A lot of kiddos have like if there's birth trauma, like shoulder issues, like shoulder gets stuck in the pelvis, things like that during delivery. And I honestly think every baby when they're born should be adjusted, just because you're curled up in a ball for 9 months, and then birth on any kid, whether it's like a normal like vaginal delivery or it's a C-section, like is just traumatic in general, because they're pulling on your head, they're pulling on your arms, all of the things. So, yeah. And also kids take a lot of falls. Like, when your kiddo starts walking and like every step they take, they're falling, adjustments help with that stuff.
A lot of impact, like constant
Lot
little
of
impact.
Yeah, a lot of impact. Crawling, they'll fall, hit their heads, all those things. Trampolines. The amount of kids I've seen after a trampoline injury is crazy. But yeah, so.
Super cool.
Yeah.
What else? You guys got anything for her?
Who are some other people you think we should talk to?
That's a good question.
They don't have to be chiropractors.
Yeah.
Just anybody you think could be interesting, fun.
The first one you said was a peptide one. Are you doing a lot? Are you trying to go for like health, like fitness, that kind of stuff?
So,
or not so much?
Not exclusively.
No, so really,
Yeah.
I don't know what you know about this or anything. We spelled GRYND really weird, GRYND,
Yeah.
to be the why behind what people do.
Yeah.
So people that just have a job. You could work a job and just do it for money and you're trying to get rich for your family. I want to hear
Yeah.
about it. You could do what you do and you're literally trying to care for people, if they're old, young, whatever.
Yeah.
We just want people, because everybody does something. When you peel back the layers, that's cool. And they
Yeah.
have a reason why they do it.
For sure.
So that's really it.
I'll think on that. That's a good question. Yeah, because everyone that's going through my rind right now is a chiropractor, and we don't
That's
need
fine.
another chiropractor.
No, we
So,
don't. We
yeah.
stop at the best.
Yeah, we're good with me.
All right,
The
so give us
best.
a quick plug. How can people find you?
Yeah.
Are you going to offer a heck of a discount code?
Yeah. So I am at Active Health Chiropractic in Joplin. It's off of Main Street. I work, it's Dr. Austin Jones, that runs the practice. And then I am an independent contractor within his business. So I have like my own LLC. It's Westmoreland Family Chiropractic. That's my last name. So everyone knows my last name now.
We'll fix that.
Westmoreland Family Chiropractic is my business, and it's just within his like chiropractic office. But they're Monday through Thursday, 9 to 6, and we close from 1 to 3 for lunch. But other than that,
Look at you.
Come
You had
on.
shitty hours, and now you're making
or
some
or
good
12:45 if you're mad.
Matt can come
Ruined
strolling
my day
in.
today.
Yeah, I'm sorry about that.
Not your fault.
I
Karen at the desk.
told her when she came back, I said, never do that again. So, yeah. I
Take
said,
insurance?
We do. We take insurance. I am working on, so insurance is a beast.
Yeah.
I'm not currently like credentialed with any insurances right now. I'm working on that. So basically what credentialing means is that like you're in network with insurances. I've been in network with them before, so hopefully the process is a little bit shorter. But once we do open up insurances, I should be credentialed with pretty much all of them. And we're actually the only office in Joplin that takes Medicaid. So if you know anyone that's on Medicaid and they want to come in.
Medicaid is
only
old?
one. No, Medicaid is like, I don't want to say poor.
No,
but
I get you.
yeah.
yeah.
But like people that,
Income level.
Income level.
Income based.
Yeah, that's a good one.
Okay.
Yeah. Medicare is old.
Gotcha.
I always think of it like you care for your elderly. Medicare.
Gotcha.
Yep. So, yeah, Medicare, Medicaid, VA. We'll take all of those insurances. So
And then do you have a cash pay option too?
we do. So I'm actually running and I don't know how long I'm going to be doing this. I really can do it, I think, for as long as I want to, but I'll probably do it for the first couple of months. My new patient special is, so if I've never seen you before, even at any of the other locations, it's $29.99 for your first visit. And then each one after that, our cash price is $50. I'm doing a coupon like special for all of my existing patients, so it's $40
Sweet.
for cash. Yep.
Nice.
Sweet
Yeah.
deal. And
Yep.
if somebody comes in there and mentions us, it'll be a better deal.
Yeah, for sure. For free. Actually.
Colton,
Yeah,
do you have any
so-
questions? He's got a body riddled with
I was just
Yeah.
thinking like,
cripolepsy
so-
or
yeah.
whatever the fuck is
I
it?
was just thinking like I'm doing physical therapy right now, so
Yeah.
I have mobility issues. A lot of it.
And speech
How much
therapy and occupational therapy and a lot of therapy
really
in his
just,
life.
I have the tism.
Yeah.
It
Me
affects
too. It's
me.
okay. Yeah.
How much of what you do kind of goes hand in hand with physical therapy?
Yeah. So I actually, and physical therapists are kind of like medical doctors in a way sometimes, where they kind of, and not everyone, some physical therapists are awesome, where they kind of like plug physical therapy over chiropractic. I am not one that does that. I think physical therapy and chiropractic, massage therapy and chiropractic is huge for people. Because physical therapists, like, they can do the manual adjustments sometimes, but they don't do it every day. They're not 100% trained in doing that. And so I think like manual adjustments through a chiropractor. And then again, I'm not super trained and I'm knowledgeable-ish in like exercises and things like that, but that's more like what their specialty is, and helping people, get through exercises, stretching, things like that. And they have a little bit more time to spend with people. Like if I had 60 minutes to stretch people, do, ultrasound, E-stim, IASTM, like muscle work, things like that, I would do that, but they just have a lot more time to spend with people, which I think is huge. So,
Because
yeah.
my physical therapist that I see, one of them, he always tells me joint drives muscle.
Yeah.
And I'm like,
You're like, that's interesting.
So-
Yeah.
yeah, I wondered because, I mean, it sounds similar, like they complement each other well.
They do.
So
Yeah.
I didn't know.
Yeah. Cause we focus more on like joints, obviously. And I do some muscle work and things like that. But if you go to them for like more muscle stuff, same with a massage therapist, get the muscles taken care of and then get the joints taken care of. They work really, really good together. So.
In the perfect world, your chiropractor, your physical therapist, your massage therapist, and your medical doctor would all have a system, like a reporting system or whatever, that communicated back and forth. And
Yeah.
you could see what the physical therapist was doing. The physical therapist could see what you were doing. The medical doctor could see what everybody's doing. You know, everybody could see what everybody was doing. So you could all be on the same sheet of music, and there wouldn't be this rivalry between
Right.
what's the word I'm looking for? Basically,
Medical professions.
yeah, between professions.
Yeah.
You know,
No, I think that would be huge. Like to have a collaboration of everyone working together
There it is. Yep.
would be, that
So
would
I
be
say
crazy.
this and I will be heckled for it. Socialized healthcare. Not in a bad Russia socialism thing. The tribe And if you guys haven't ever been to one, which you probably haven't, I can walk in there. I can get my teeth cleaned. I can get my eyes taken care of. I can do physical therapy. I can see a general practitioner. I can see an acupuncturist. I can do all my physical therapy. The only thing they don't have there is chiropractic.
Yeah. That's actually funny you say that, because I have a patient who her whole family is tribal, and they go to the chiropractor that I used to work for, and they get their adjustments for free because they go through the tribe.
Huh.
So I'm curious, how that works. Because it should be you and your son.
Yeah.
Would be covered.
Yeah, he does all his stuff out there.
So,
I've never asked him about covering my stuff.
Yeah.
All under one roof?
Yeah.
Man, that could be so valuable in terms of communication between practices.
Yeah.
Well, thank you so much for doing this.
Yeah,
I know it's time away
thanks
from your
for having
family, but our goal here really is to grow community. And I mean, this is fun. I get to hang out with my buddies, and we get to talk to interesting people.
Super fun.
A lot of the podcasts that I listen to are people that are selfish. They're like, I talk to people that I want to. I don't care what anybody else wants. And this is really where we're at. We talked to Jeremy about peptides. Everything we've got lined up is interesting people that we want to talk to. He brought up Dr. Dani. I'm like, dude, I'm in. So 100%. You got a new family of patients.
Yeah.
So,
well, I appreciate it. Yeah. I am excited. So
awesome.
yeah. Thank you so much for having me.
Yeah, this is great.
Yeah,
it was not near as bad as what you thought it was.
I was nervous. I'm not going to lie. The whole day today, I was like, I'm nauseous. I'm literally nauseous. Yeah.
No.
It is
all
just
day.
a conversation. See, we get people in a box every day, and I tell them, like, this isn't an interrogation. This is just a conversation that we're going to have today.
Yeah. Yeah. No, it wasn't bad. It was great.
It's easy.
Yeah.
Yeah. No, I was literally messaging Matt. I'm like, do you have a list of questions? Like, I need I'm just like that. I'm type A. Like, I'm like, I need a set of questions so I know how to answer these properly. But
Yeah.
I knew it was going to be we get started and it just goes
Yeah.
kind of thing.
And those are
it
always
was
the
good.
best.
Yeah. It was good.
Keeps
Awesome.
it organic and it flows well and it just turns into a fun, easygoing conversation.
100%.
We'll do it again sometime.
Absolutely.
Danny,
Yeah.
you've become a friend.
Yeah. You too, Matt.
I value what you've done for me more than probably most of your patients tell you.
Yeah.
I've seen you when I could barely walk. I've seen you when I had headaches so bad I couldn't hardly keep my eyes open.
Yeah.
And most of the time now I have no problems other than little flare-ups here and there. You keep me between the lines physically, and I appreciate it.
Yeah. That's
You're
awesome.
not just a chiropractor. You've become a friend, and I appreciate you.
You too, Matt.
So thanks for
sure.
coming and hanging
Yeah.
out with us.